We actually invited Louise Beale to provide some commentary on the community perspective. Unfortunately, she was not able to come to the Netherlands for this conference for personal reasons. So I actually thought of opening the floor for 5 minutes to the audience to see whether you have questions or comments to what Adam just presented. So please come forward. Anyone from the panel here that wants to comment to Adam's work? I was actually wondering, Adam, how important is it then to address the syndemics of belonging to different key populations when you're a person using drugs?
That is a good question. So very often, the way in which we design, we report, we monitor interventions are divided by key population. You are an MSM, you're a person who uses drugs, you are a sex worker, you're a transgender person. It has been incredibly cumbersome over the years to see how we can adequately account for those overlaps. And I think certainly in relation to chemsex, the sexualized use of drugs, in many countries and at a global level, we've seen it kind of falling between the cracks. There's UNAIDS who, well, no, I shouldn't be too, no, I don't want to name names. There are organizations that have been historically focused on HIV and sexual transmission circumstances, and there have been organizations that have been focused on injection drug use. Now, and on both sides have been saying, well, it's kind of your responsibility to deal with it. It's your, but it's you who, it's a drug issue, so you should be dealing with it. It's a sex issue, so you should be dealing with it. And at a micro level, in many cities and in many countries, that's caused problems around the commissioning of services. So certainly in London, for example, the public health pays for, the local council will pay for sexual health services. One team pays for sexual health services, an entirely different team pays for drug services. And when you're using drugs in a sexual context, it's really hard to design and deliver an intervention that is sufficiently funded. I don't have an answer, but just to acknowledge that at a whole range of different levels, it's a problem when we observe overlapping populations like that.
Thank you for that, Adam. Please.
Good morning. My name is Jeremy. I represent Positive Malaysians Treatment Access and Advocacy. But today I'm speaking in the capacity of MSM and Positive Living. Okay. In Malaysia, I would like to affirm, Adam Bond, basically most of the factors that have been shared is more or less the same as what is happening in Malaysia as well. And I think the strongest ever is actually religions and stigma and discriminations. And having said that, right, correct, drug use among MSM have even rampant a lot more. And basically sharing from one of my colleagues who is the chairperson of a community-based organizations that's doing community screening. But even though they are trying to specialize, but because of funding issues, they are not able to outreach to the hidden populations, especially the drug use population in Malaysia. And to add on as well, recently, under the CHERIA, which is Excellent Research in AIDS under UMMC, they did a drug use studies among MSM. And that further enhances what have been shared today. So if you were to ask me as a gay man, and what should be done, basically, the government, the new government as in Malaysia, should be more open to let the gender sexuality be more expressed and to deal with the issue more abroad, rather than just academic and doing research. More on ground, more funding for the CBOs to do what they necessarily do, but having said that, giving them the flexibility, giving them the tools and the resources. Currently, the CBOs that are doing this work, right, they are mostly on outreaching on hospital for MSM who are positive living. Why is it should we be focusing on just only outreaching on those who are already detected? I'm not saying that we should not, but we should put more emphasis on prevention, which is lacking. So, Jerry, just to close my sharing, both are based on my colleagues. Currently in Malaysia, 90% are sexually driven, epidemic. And the MSMs who are being diagnosed are getting younger and younger, including those who are drug use, sorry. Okay? Yeah, thank you.
Thank you much for your comment about openness in governmental and public health regarding belonging to different key populations and for people who use drugs.